Good evening and welcome to this week's edition of TechNow. Tonight, clinical trials of new medical ideas, how technology can help speed up the process without jeopardizing safety. Also, the sun like you've never seen it, three-dimensional images of old Seoul. Plus, robots programmed with human emotions and smarter than ever before. Clinical trials in medicine are the crucial step to move a good idea from the lab into the real world. Ottawa-based Know-How is now helping researchers to move from paper-based testing to using the internet. What can that mean? It's that medical advances get to consumers sooner.
Take care. Yep.
Charlie Hoff has congestive heart failure. He's had 3 heart attacks, open heart surgery. Now he's a volunteer for a clinical trial.
I thought, this is my best shot, and I got to get in here.
It's estimated in the U.S. alone there are nearly 12,000 clinical trials underway.
Clinical trials are so important. There is no medicine, there's no scientific medicine without clinical trials.
So times are good and it's time to move, right?
Absolutely.
Peter O'Blennis is co-founder of TrialStat in Ottawa, a fast-growing firm, $5 million in new investment cash to expand an electronic-based data system for clinical researchers. It allows patient information to be gathered online instead of on paper. He says it means reduced costs, better information, and faster results.
That can mean tens of millions of dollars to the organization that's producing the drug, and the shorter wait time for the patients who need it.
A clinical trial is the last step in a process that can last a decade and cost up to $1 billion if you're producing a brand new prescription drug. O'Blennis says it's taken several years for the conservative medical business to start using an electronic system. Being web-based, it allows information on patients to be entered from many locations by many people. Asking patients how they feel or what hurts. It's a tedious process, but it is the heart of research.
Clinical trials in general are a high-stakes game. So you've got patient safety to consider. You've also got the future of entire companies to consider. Time to market is critical for these organizations that are bringing new drugs to market.
I think when we're talking about involving human beings in a process.
Jeff Smith is president and CEO of Allphase of Ottawa. They're what's called a contract researcher, hired by a pharmaceutical company. They oversee and manage clinical trials. They ensure the growing number of rules and regulations are followed.
Now with the electronic data capture, you're collecting the data throughout the trial as it's happening at the sites, and you could do interim analysis on that data if you had to look at safety, look at data from a safety point of view, whether you need to stop the trial or extend the trial.
Nobody wants to be taking a medication that hasn't been thoroughly tested. Everybody wants full disclosure. They want to know what the side effects are. The physicians that prescribe the medications, they want to know what the medications may interact with, what other medications they may interact with. So from a human perspective, there's a lot at stake, and from a financial perspective, there's a lot at stake.
TrialStat is about to launch another assist for researchers, a website called ESR Nexus. It's just like a medical Wikipedia. Top research centers from around the globe have already posted 16 million reference studies on a wide range of medical ailments. The site is free, it's open to the public, and to the next generation of clinical researchers as they begin projects.